Hi, my name is Allison Labella, and I'm going to be presenting to you on epilepsy. And we're going to talk about incidence, prevalence of epilepsy, especially in the K to 12 population. We'll also talk about different terminology and symptomology, as well as implications for all educators, treatment of epilepsy, and about future direction in the school. So, what is epilepsy? It's a heterogeneous disorder which can result from genetic and non-genetic factors. It's a high risk in individuals who possess a serious neurologic abnormality, such as cerebral palsy or mental retardation. Most active cases occur in children and young adults. It is the most common treatable serious neurological condition among that age group. And overall, it's the third most common serious neurological disorder in general after cerebral palsy and autism. So now we're going to talk about prevalence of epilepsy. 0.5 to 1% of children through age 16 have epilepsy. Febrile seizures are the most common type for this age range, affecting between 75,000 and 100,000 children. Overall, between 20,000 and 45,000 children are diagnosed annually with epilepsy, and the most susceptible are those in their first year of life. Seizure onset is typically between age 5 and 6, and research suggests that there might have been a decline in the incidence over the last few decades, possibly with the rise of vaccinations for meningitis and improved diagnosis. Next, we're going to talk about incidence. We're going to talk about comorbid mental disorders. So 1 in every 3 patients with epilepsy will experience a depressive disorder at some point in their life. Major depressive disorder, or MDD, is found in many patients, which is diagnosed following a major depressive episode, which can last 2 weeks. Depressive episodes can be unipolar, which is only depressive, or bipolar, which can be manic and depressive, or just hypomanic. In addition to depression, anxiety, OCD, psychosis, stigma, poor self-esteem, and coping difficulties can all be a result of epilepsy, and this can greatly impact the quality of life. Deficits in attention and memory can also occur. Now we're going to talk about symptomology. So epileptic seizures can be localized/partial, as well as focal. Those are 3 terms that can be interchanged for localized seizures, or they can be generalized. Focal seizures stem from networks from a single cerebral hemisphere of the brain, while generalized seizures essentially arise from bilaterally distributed networks. Febrile seizures are most common in children. As far as symptoms, localized seizures, which I said were also focal or local, include simple, which would be jerking, muscle rigidity, or spasms. Complex, which is involuntary coordinated movements, or a partial seizure can evolve into a loss of consciousness. So generalized seizures/symptoms include grand mal, which would you'd be unconscious, you'd be convulsing, or you'd have muscle rigidity. So another seizure would be an absence one, in which you would have brief loss of consciousness. A myoclonic seizure is sporadic, and you have isolated jerky movements. Tonic, you have muscle stiffness and rigidity, and atonic, you lose muscle tone. But that's just a brief overview. Any of those seizures can have other symptoms. So next we're going to talk terminology. Epileptic seizures are classified as symptomatic, cryptogenic, or idiopathic. Remote symptomatic seizures occur due to a previous brain injury, such as mental retardation or cerebral palsy. Cryptogenic seizures occur in otherwise normal individuals. Idiopathic seizures tend to occur in individuals who have a genetic history of epilepsy. Cryptogenic and idiopathic seizures used to be grouped together until the late 1990s. So next we're going to talk about remission and treatment. So data indicates that more than 70% of individuals with epilepsy will eventually enter remission, and often this occurs early in life. 22 medications are found to be effective in treating epilepsy. Although 30% of patients who take medications do not notice a positive change in their seizures and they don't like the side effects of their medication. An implantable device called the vagus nerve stimulator, or VNS, can be used for partial seizures. The VNS sends an electrical impulse to the vagus nerve, which is located in the neck, which travels back to the brain, and it helps to stop or reduce seizures. About 5 or 6% of patients have seen complete stop in their seizures, but roughly 70% of patients have seen their seizures reduced. Okay. So next, we're going to talk about other treatments. The NeuroPace was developed by the FDA in 2013. It is a device that responds to seizures, sending an electrical impulse to the brain. Data has shown that after 3 months, seizures are reduced by 40%, and after a year, 43% of patients notice a significant decrease in seizures. 7.1% of patients completely stopped having seizures. Brain surgery can be an option for epileptic patients who have partial epilepsy. However, potential risks such as bleeding, stroke, and infection can occur. So next we'll talk about mortality. Epileptic patients have an increased risk of sudden death and mortality. Rates of mortality tend to be increased when childhood onset epilepsy is followed to adulthood, or in individuals where remission does not occur. Sudden death can occur in children with epilepsy, but it's rare. However, sudden deaths appear more common in young adults who have childhood onset epilepsy. So as far as protection from the law, the IDEA, or Individuals with Disabilities Education Law, Section 504 of the Rehabilitation Act of 1973, and the Americans with Disabilities Act, ABA, all protect children with epilepsy. Under IDEA, children with disabilities, such as epilepsy, are guaranteed a free, appropriate public education that emphasizes special education and related services designed to meet their unique needs, and prepare them for further education, employment, and independent living. Additionally, the IDEA mandates that special education and related services are widespread, which includes the classroom, a residential special education facility, and if necessary, full-time special education facility housing for children only with disabilities. So as far as implications for educators, it's critical that all educators working with a student that they're aware of the type of epilepsy the student has, as well as what types of seizures they have, in order to realize the student's ability to concentrate and learn may be impeded. It's also important to note that a student's mental health may change before the seizure, during the seizure, and after the seizure, and that medications can impact the well-being of the student. An IEP has to be utilized with information pertinent to current level of academic achievement, functional performance, and measurable annual goals, as well as how the goals will be measured, when reports on progress will occur, and any special education related services, aids, and other services that will be provided, as well as accommodations listed in the IEP. So then methods of support / assistance. School counselors can provide coping skills for students who are negatively affected by other students and peers. Parent counseling might be useful for some students to realize their children's needs. Occupational or physical therapy might be an option for some children. Behavioral intervention plan might need to be implemented for students who exhibit behavioral problems. For example, if they have a concurrent mental health disorder like manic depression. An IEP can contain a clause on dietary modifications for those students who adhere to a ketogenic or Atkins diet to combat epileptic side effects. Okay, and then what we're going to talk about to conclude is future direction for working with children in the K-12 age range that have epilepsy. Those working in the field of education need to be cognizant of the prevalence of the special education classification and its growing treatments, as well as the laws that protect an epileptic child. Educators need to realize how accommodations can vary greatly depending on the needs of the student. And last but not least, this is an expanding field, so diligent research is being conducted so that healthcare providers can choose appropriate treatment modalities for patients. And that's pretty much it. Hope you enjoyed. Thanks.